Next we have is another topic, which is the administration by inhalation. So far we have discussed the oral dosage forms. Now we will discuss the inhalational drug dosage forms. So the next we have is inhalational route. So the drug administration by inhalation involves delivering medication directly to the lungs through the respiratory system. This method of drug delivery is commonly used to treat respiratory conditions such as asthma, chronic obstructive pulmonary disease (COPD), and cystic fibrosis. Inhalation can be achieved through a variety of devices such as inhalers, nebulizers, dry powder inhalers. These devices work by converting medication into the fine mist or powder, which then can be inhaled into the lungs. Inhalation offers several advantages like a rapid onset of action, targeted delivery, and first-pass metabolism, which can reduce the amount of medication needed to achieve therapeutic effect. Additionally, inhalation therapy can minimize side effects also with oral or intravenous administration of drugs. However, inhalational therapy requires proper technique and compliance from the patients to ensure effective delivery of medications. Like I have seen a number of patients who use inhalers in a wrong way, and patients should be instructed on proper use of inhalation devices and how to clean them, maintain them to avoid contamination or decreased effectiveness. It is important to work with the healthcare provider to determine the appropriate medication and device usage. That is highly recommended. So, moving on, we have inhalers and nebulizers. So, both inhalers and nebulizers are devices used to deliver medication directly to the lungs through the respiratory system. However, they work in a slightly different way. An inhaler is a handheld device that delivers medication in a metered dose or as a dry powder. This medication is typically inhaled through the mouth and into the lungs. Inhalers work by using a propellant or a mechanism to create a fine mist or a powder. This is fine mist or powder that can be inhaled. The medication is contained in a small container-like setup, which is also called small canister, and the device typically has a mouthpiece or a mask that the patient uses to inhale the medication. On the other hand, a nebulizer is a device that converts liquid medication into the fine mist or aerosol, which can then be inhaled through a mouthpiece or mask. Nebulizers work by using compressed air or ultrasonic vibrations to break up the liquid medication into small particles, typically ranging in the size from 1 to 5 micrometers. The nebulizer then delivers the aerosolized medication through a mouthpiece or a mask that the patient inhales. Now, both the inhalers and nebulizers are used to treat respiratory conditions such as asthma, COPD, and cystic fibrosis I have discussed previously. Inhalers are often preferred for patients who require quick relief of symptoms such as asthmatic, while nebulizers are typically used for the patients who have difficulty using an inhaler, like if they are unconscious or require a larger dose of medication. It is important to work with the healthcare provider, obviously. Next we have is mucociliary action. Now, what is mucociliary action? So the mucociliary action is a protective mechanism of the respiratory tract that helps to clear the airways of foreign particles, debris, and microorganisms. It is the combination of two different processes, which are mucus production and ciliary action. The lining of respiratory tract produces a thin layer of mucus, a sticky substance that helps to trap foreign particles and microorganisms. The mucus layer is constantly moving towards the throat, a process known as mucociliary escalator, because this process behaves like an escalator from the larynx to the throat. This movement is driven by the cilia, these hair-like structures that extend from the surface of the respiratory epithelium. The cilia beat in a synchronized fashion, creating a wave-like motion that moves the mucus layer along the surface of respiratory epithelium towards the throat. Once in the throat, the mucus is either swallowed into the stomach or expelled from the body. Mucociliary action plays an important role in maintaining healthy respiratory function and preventing infections. Impairment of mucociliary action can lead to accumulation of mucus, which can create an environment for bacterial growth and increase the risk of infections, obviously. Certain respiratory conditions such as cystic fibrosis, chronic bronchitis are associated with impaired mucociliary action, highlighting the importance of this mechanism in maintaining respiratory health. Some inhalational drugs such as mucolytics are designed to modify the properties of mucus to make it easier to clear from the airways. These drugs usually work by breaking down the bonds between mucus molecules, which thins the mucus and makes it easier for cilia to move, outward. Other inhalational drugs such as bronchodilators and corticosteroids also work by relaxing the smooth muscles. Now, these are all the smooth muscles that surround the airways or reducing inflammation. This can help to open up the airways and improve the movement of mucus through the respiratory system. Inhaled medications can also interfere with mucociliary action if they are not used correctly. For example, we have discussed previously, if an inhaler is not used properly, the medication may not be deposited correctly in the airways and may not interact effectively with the mucus layer. This can reduce the effectiveness of the medication also and may impair mucociliary action. Now that is all for today. Keep following sqadia.com for more such videos. Bye-bye.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.